Good morning and welcome to Clark County for, excuse me, our work sessions this morning and council time this afternoon. You may wonder why I am chairing this meeting. It's because our chair is out on vacation, our vice chair is out on sick leave, and then it goes to the person who is most senior. So here I am on this day of infamy, 9/11. But what we have in store for us here at Clark County is really quite nice. First, we have an informational update from the to the Board of Health, and then we have a fee schedule updates for land use review and wetland habitat review. And then I hope that you all will join us again at 1 o'clock when we have our council time and the regular agenda there. So if we may begin, I see Dr. Melnick is here. Would you like to get started?
Thank you, Bowerman. Councilor Bowerman. Good morning. For the record, Dr. Alan Melnick. I'm the Public Health Director and Health Officer. So this is just a little preview of what you're going to hear from us at the full Board of Health meeting later this month. We'll be talking then about identification of lead exposure and prevention. But for this meeting, I just wanted to give you a little background on lead and why it's an issue. So later this month, our environmental health specialist who works in the program will discuss how we work with healthcare providers, how we do environmental lead investigations, and a tool that we're using. But in the meantime, I just want to give you some background on lead. So as you all know, lead is a naturally occurring, it's a heavy metal in the environment and can be found in air, soil, and water, and unfortunately can also be found in homes. By the way, lead has no, I'm going to get into this in a minute or so, lead has no function in the human body. It doesn't belong there. We'll talk about this a little bit more. But there's a variety of sources of lead exposure. For example, and we see a lot less of it once lead-based gasoline was, lead was banned from gasoline. But right now, lead-based paint and lead dust are the main sources of lead poisoning. Homes built before 1978 have a good chance of having some lead-based paint, and that can chip, peel, or flake. Believe it or not, lead, I don't want to advertise this, but lead, I believe that lead paint chips can taste sweet. So there's an opportunity for example, babies or toddlers being able to chew on paint chips and obviously get exposed there. Also, household dust can contain lead particles released from old paint during remodeling. So remodeling can kind of get stuff into the atmosphere and into the air and dust. And doors, windows, and drawers can also contain lead contaminated dust. Other sources include contaminated soil. Lead doesn't travel vertically very well, so when it gets into the soil, it can remain there. Plumbing for drinking water, lead pipes, children's toys and toy jewelry, workplaces and hobby hazards, aluminum or glazed ceramic cookware, imported spices, and traditional home remedies to treat illnesses. The spices are kind of interesting because lead comes in paint. It kind of is found in some dyes that are used in other parts of the world for spices. So you can be exposed to lead several different ways. One is inhalation. So inhaling lead dust from lead-based paint or lead-contaminated soil. And of course, that can occur during remodeling or engage in hobbies. When engaging in hobbies, you might recall a number of years ago, we had lead poisoning in children and adults who participated in a indoor shooting range, and some of them had high lead levels, and they were exposed to lead dust from the firing range. Eating or drinking food or water that has lead. So You may recall the situation in Flint, Michigan, where there was lead contamination in the drinking water. So you can actually absorb it through the skin too, but the inhalation and ingestion are probably the most common ways of being exposed to it. That can include cookware, dishes, or glasses that have lead. And as I mentioned, children can put things in their mouth, like lead paint chips, or they can be exposed to dust. They can also be exposed if they're playing with toys that have lead paint in them as well. So why are we concerned about lead? Well, lead is kind of like a silent poison. It doesn't belong in the body, but even in low levels, it won't produce obvious symptoms. But it's also a neurotoxin. So children with developing brains, the young children under 6 are the most likely affected by lead exposure, just by uh, not only are they more likely to be exposed based on what I've already described, but their brains are developing. Their growing bodies absorb more lead than adults do, and their brains are more easily damaged. There's no safe level of lead. As I mentioned, it doesn't belong in the body. So, but the subtle effects of lead in children, it can cause lower IQ, can affect your brain development, can cause behavior, learning problems, can cause hearing problems. It can make you less effective in school, paying attention in school. It certainly can result in lower IQ. It can also cause slower growth and anemia, affect the blood cells, anemia in children. Um, Lead in adults, including pregnant people. And by the way, pregnant women who have lead exposure can pass the lead to their fetus. So that's a problem as well. But it can cause in adults hypertension, and it can also cause kidney and reproductive problems for adults. In rare cases, lead can cause in very high levels. Once you get to really high levels, it becomes symptomatic, and you can develop seizures, coma, and even death. Severe abdominal pain as well. So that's the background in terms of the health effects on lead. Um, you can do blood tests to estimate to measure the amount of blood in the amount of lead in your blood and estimate the amount of exposure to lead. And testing is the only way to find out whether somebody has been exposed. The test can be done, physicians can either do it with a capillary finger stick or a venous blood samples. And if the levels are high, a repeat test needs to be done. Federal regulations require that all children enrolled in Medicaid receive a blood lead test at 1 year and 2 years of age. And being low income is a risk factor for exposure, and that is undoubtedly why it's tied to Medicaid as well. The Washington Department of Health recommends all children not covered by Medicaid receive blood lead testing at 1 and 2 years of age based on an algorithm that I'd be happy to share with you. But the algorithm measures their likelihood of being exposure, and it considers things like whether the child lives in a home or regularly visits a home built before 1950, if they have a sibling or playmate with known elevated blood lead levels, or if they have a parent or caregiver who works professionally or recreationally with lead. Fortunately, only a small number of babies and children have high enough lead levels that they need treatment. And once you get to really high lead levels, that might include medications called chelation therapy that helps remove lead from the body. The case investigation work that our team does, lead is a notifiable condition. So physicians if they identify high lead levels required by law, by WAC, to basically notify us. So we'll talk later this month about how we get these reports and how our team does the investigation and then the prevention efforts that we're involved in. That'll be later in the month. So I just want to give you an idea of how prevalent the problem is. We receive about 20 case notifications each year. About 20 to 25 cases involve an investigation, including a home visit. And we currently have about 17 active cases open in Clark County. No level safe, there's no safe level of lead, but we use what's called a reference level. So that's a level that CDC has determined at which the level at which if a child is found with that level, it's in the highest 2.5% of children 1 to 5 years of age. And the current reference level is 3.5 micrograms per deciliter. And depending on what the level is, there are different actions recommended in terms of follow-up and further treatment if necessary. So the bottom line on this is, in terms of the effect on the brain, there's no antidote for lead, and the effects of lead poisoning are not reversible. So we really need to prevent this, and identify potential sources of exposure and prevent any additional exposure. So I'll leave it there. I don't know if you have any questions. I just wanted to give you a background before our longer discussion and description of how we approach this later this month.
Council, questions? I have a quick one. What does the chelation therapy do if it is not a cure? How does it help?
So lead will remain in the body. I mean, it gets deposited, even gets deposited in bones. You can get, what it does is it mobilizes and removes whatever lead is in your body from your body.
Oh,
You don't want to leave it there. I mean, if you get to those high levels, you want to be able to remove it.
so in a sense, it is a cure. Is that correct?
Well, but some damage will have already been done by the exposure as well. So, end organ damage, like, if you have some damage to your brain, but it'll reduce the continued exposure. So,
A quick question.
Go ahead.
We talked about contaminated soil. If plants are grown in that soil, will they absorb the lead into them?
that's a good question. Theoretically, yes. I wouldn't recommend growing plants in lead soil, but, I don't, in terms of your garden and all that. That's a good question. I may have to get back to you on the 2 week, we meet in 2 weeks to see about that. I wouldn't recommend growing plants I don't know if anybody we have some of our team members on the call here. I don't know if they have the answer to that one, we might be able to answer that now.
And how would we even know if lead was in the soil?
You would have to get your soil tested. But I mean, I don't want everybody to panic that they have lead in their soil. We're much less likely to have lead deposit in our soil now than we were a number of years ago, especially, for example, when lead was, in gasoline. And if you're an old home and you did remodeling and you would hopefully cart your whatever from remodeling, you would cart the debris away and not deposit it in your garden. But for most of us, there's no reason why we should have lead in our soil. I think I remember when we had the indoor shooting range a number of years ago, they had a system where they at the end of the shooting range where they had a trough and they had water flowing through there, and some of the material was deposited in the soil around the building, and we had to have a cleanup effort there. We were concerned that like neighbor kids might be crawling around there or something like that. We didn't want any exposure, so we worked with them, and that soil was removed. But so there are ways you can deposit lead into the soil, but for most of us that isn't an issue.
Councillor Marshall, do you have any questions?
Well, just a couple of things. I look forward to the full presentation, but I'd be interested. I think it was in Portland several years ago in the schools there was contamination. So I'd just be curious about institutions and whatever exposure risk might be occurring locally or mediation that has occurred. and then also what consumer protection might be in place for imported products that could be contaminated.
Those are great questions. By the way, just going back to the soil for a minute, you know, one of the reasons for screening kids in these higher risk settings is if you do find elevated lead levels besides addressing the child and their health, that also may stimulate an environmental investigation. So that's why we'll have our team talking about later this month. In terms of and that's another reason for testing kids, but we'll get you more. Councilor Martha, we'll get you more information on, right now in terms of the like imported products and things like that, in terms of regulations. We'll have our team presenting that later this month and give you more information about that.
Great, thanks.
Anything else, Council? And anything else that Dr. Melnick, you or your team wish to add?
We look forward to seeing you all in 2 weeks and really getting into this. So hopefully address some of these questions in terms of, you know, the prevention and consumer prevention as well.
We bought a 100-year-old home at one point, and when we remodeled that, it was extensive, needless to say. And even taking off the paint off the ceiling was even a challenge, because it just goes in clouds all over the place. And, you know, your babies crawl around in it, and it just is really frightening. So thank you for this update that's coming up. We appreciate it.
Even, you know, even on windowsills, if there's paint flecking off, you need to really, you know, wipe. Well, we'll talk about that later this month about what you can do to mitigate this, because we have experts on our team that know a lot more about this than I do. So
excellent. Well, thank you very much, and we'll see you soon and in a couple of weeks for sure.
Thank you. Bye.
Bye-bye. And now we turn to a work session that is on the